Good afternoon, everyone. Welcome to session 5 of the Brain Health Community Collaborative Echo Series. We appreciate you joining us this afternoon as we continue our healthy aging conversation together. I would like to turn our attention today to our topic at hand and welcome our first speaker, Dr. Masoud. Dr. Sara Masoud is an assistant professor at the University of Texas Health Science Center at San Antonio and director of the the Collective Community Action and Research Engagement, or CARE Lab. Dr. Masoud's work involves developing and evaluating approaches for conducting research with underrepresented populations. We're thrilled to have you, and I will go ahead and turn the conversation over to Sara.
Thank you so much. Let me share my screen. Perfect. Thank you. Thank you for the introduction. I'm really grateful to be here today. I am Sara Masoud. I'm an assistant professor at UT San Antonio's School of Nursing. And today I'm presenting on behalf of a collective of individuals who have been working together in South Texas for almost 5 years now. And I'm excited to share with you more who the people I'm representing are. The project I'm presenting is about community-driven dementia research priorities. So, this is in the spirit of translational health research. If we are trying to support the well-being of families impacted by dementia with research, an important aspect of that is studying what matters to communities as far as they dictate. So a bit about South Texas, and I'm so sad I have to do this, but I have to hide your pretty faces because I can't see my slides on my screen. So I'm going to pretend you're smiling and applauding and cheering me on through this whole presentation. So South Texas is a region of the United States that has some of the highest dementia prevalence rates. In a recent study, it was determined that Texas is the state with the most counties with the highest prevalence of dementia. Up in some counties of South Texas, up to 1 in 5, and some estimates even say 1 in 4 people are living with dementia. So it's definitely a crisis of a public health crisis in the region. And then adding to that, and I do hate to speak in a deficit orientation, South Texas also has so many beautiful strengths. It's not just this devastated place. People are thriving and living beautiful lives there. But I want to, for the sake of time, underscore just how deeply impacted this community is in terms of dementia. The infrastructure of the region is quite limited. There, over the last, 4.5 going on 5 years that we've been doing our project together, we've met with so many families who are impacted by dementia, have been in households, connecting with caregivers who, some of them say, if we needed to call an ambulance, we would be waiting, at the very least 30 minutes, if not an hour, for an ambulance to reach our home, right? So we're talking about limited health infrastructure in the most rural areas. And then also in the cities, Laredo, Harlingen, Eagle Pass, these are quite big cities. And even those cities are struggling. There isn't ready access to neurologists, to the specialists that would be needed to provide impactful care. South Texas is predominantly Latino or Hispanic identifying. Our council uses the term Latino just for shorthand, but I don't want to diminish the diversity within the group. Latino communities are 1.5 times more likely to be impacted by dementia than non-Hispanic, non-Latino white communities, and yet are severely underrepresented in research. Some national institutes of health institutes within the NIH have as low as 2 to 5% representation. And I think across all institutes, some of the estimates are, 11 to maybe 20% participation of Latino Hispanic participants in dementia research. And this is a translational science issue. If you don't have populations represented in research, that research may not be as effective or relevant or impactful when it eventually produces whatever real world impact, right? So it may not be relevant to that population. So researching what matters to impacted communities can improve the inclusion and the translational potential of findings. So our community council, it includes family caregivers, people who are living with dementia, community health workers, healthcare providers, just hiding the meeting controls. We've been gathering, we formed, we got some funding and we decided to all get together. We still have some of our founding members, individuals living with dementia and caregivers who have been there from day one. Outside of just a few months here and there, maybe taking the holidays off, we've met every month at least once to conduct this project. And it's a very dedicated team. In our earliest formation, we were 16, 17 people. Today we are 13, 15 people, some familiar faces and some newer faces. The council decided we wanted to connect meaningfully with families impacted by dementia in the region, knowing what a crisis it is. So we decided to develop a program model. We call them the Platicas, conversations, but it's much more complex than just conversations. We really took into not only cultural specificity, music, food, we also took in contextual specificity. What is it like to do a community Platica to connect with families who are all the way down in Brownsville versus Laredo or Robstown, which is quite rural? So we really took time to identify local leaders to join our council to help us do bottom-up program development so that we could really connect with communities. And I'll just say as an aside, these have become really popular. Sometimes we have people, we've had people drive from Houston to attend one of our platicas, like in Laredo or Eagle Pass, like driving all this way because they had, caught wind of how wonderful these events are. So these semi-structured reciprocal dialogue at the platicas where the council members are also sharing as people who have been impacted by dementia in different ways are also sharing, you get to a really deep place of conversation and connection. We used those conversations, notes that we took to then conduct a study to say, hey, we really want to know if researchers want to support South Texas communities, then we need to make sure that our studies actually align with what they want us to study. So we conducted a 2-year participatory study within the 4.5, 5 years we've been a council to answer what do South Texans impacted by dementia want research to study. From the Platica conversations, we created a priority setting survey. So all the topics were important. You'll see that in our results because they came from conversations. They were important enough to be discussed at the Platicas. So when you put them in a study, they're all going to be quite important. But we wanted to know of those 21 topics of importance, which ones were the most important to South Texans who are living with dementia. We asked people to rate importance on a scale of 1 to 10, 1 being least important, still important, but maybe it's of the topics is the least important, to 10, greatest importance. And then we asked everybody to rank their top priorities within 4 themes. We organized the survey into 4 thematic groups. Just a quick picture of who completed our survey. We ended up having 152 people complete the survey. Most of these people were individuals who had attended community platicas, and then maybe they, took the survey to family members also who weren't able to come to the platica, but they wanted their voices included. The majority identified as Latino Hispanic. So South Texas is a majority Latino Hispanic community, but not everybody is. So I think, we're pretty aligned with the general population of individuals at 76% Latino Hispanic identifying. Most were caregivers or extended family members. Not everybody identifies with caregivers, so we tried to make the title of caregiver. So we tried to make room for that. I'm Arab, and it's the same thing in the Arab population. We maybe wouldn't call ourselves a caregiver, but we might say I'm a family member. I'm a granddaughter of somebody living with dementia, as was my experience. So we had a majority, 95%, give or take, were people who had been in some way in their family impacted by dementia. Although we had quite a few people living with dementia participate in the platicas, only 4% of our respondents were people living with dementia. So this is a majority caregiver study in terms of the priority setting, and most identified as women. So this is a lot of text, and we don't have time to go through all of it. I'd love to share more in the discussion about it. I first organized this slide. You can see very faint yellow. The top bolded topic of each of these four themes. When we asked on a scale of 1 to 10, what was the greatest of importance to you? We found in theme 1, awareness of dementia among the Latino community is understanding how diet and lifestyle factors can increase risk for dementia. In the theme about living with dementia, this is mostly focused on the individuals themselves or what would be relevant to individuals living with dementia. People really felt that finding ways the healthcare system could make it easier to get a timely diagnosis was important. And then in the theme of families or caregivers for someone living with dementia, it was non-medication treatments that can help with behaviors that people living with dementia experience. So a deep interest in alternatives to, anxiety, antidepressants, the drugs that manage behavioral symptoms, a lot of interest in resources, programs, at-home care, etc., education programs as well. And then as far as resources to support the whole family impacted by dementia, creating and raising awareness of policies such as the financial support and insurance access that can improve care and support families. When we look at it across the board, not by theme, we notice one change, and you'll see that there's alignment within each theme, but actually the fourth, across all topics, we see that making sure families have information to plan future care, such as medical and legal issues, was quite important. Again, you'll see that the lowest scores are in the 8s. All of these topics on a scale of 1 to 10 are very important to communities. So in terms of guiding research, you could really look at any one of these community identified topics and be in strong alignment with what South Texans care about. When we ask people to pick their top priority by theme, we found similarities between the rating on 1 to 10. But we did find in theme 4, this information to plan future care, such as medical and legal issues, was ranked number 1 within that theme. So a slight different, but important to underscore that families are trying to think of the future. And I think this is important for all contexts, but specifically the South Texas context, where it's quite difficult to plan when you're still struggling to get your day-to-day care needs. Planning long-term can also be a challenge. So breaking it down, when our council also did an interpretation workshop of all of our data, and we tried to say, okay, if we had to give the top 3 priorities that we learned from these breaking bread, sharing meals with South Texans. I mean, this is, at the Plática attendees, we've had over 400 people, if not 500 at this point, come and sit at the table with us. And, you can see in this picture, every single group has a member of our council sitting with them, listening, hearing their stories, representing that in this study. Number 1 would be those non-pharmacological, non-medication interventions for behavioral symptom management. Of the struggles when people are experiencing that, it seems to be one of the most challenging struggles to experience. Also, attaining a timely diagnosis. This kind of contradicts a lot of the scientific evidence that we see when you go to the scientific literature, that Latinos, Hispanic communities are maybe avoidant in seeking care. There's a lot of finger pointing in the literature that for some reason culturally there may be like a mistrust of doctors. That was directly contradicted in our conversations with South Texans. There is a deep interest in getting a timely diagnosis, and if we were to invest those resources in the region, they would absolutely be utilized. I don't want to oversimplify the structural barriers that keep people from accessing resources when they do exist, but there is a deep interest in the community, a deep desire for access to timely diagnoses. And then, in line with the desire for timely diagnoses is that ability to plan for the future care planning, medical, legal, and financial. So why does this matter? Supporting caregivers is more than just listening. It's more than just visiting the existing literature. I know I'm preaching to the choir as translational health researchers, or at least the people attending here. This is being hosted by the translational health researchers of Texas State. You actually have to make a concerted investment in doing bottom-up relational work if you want to support communities sharing power with communities and conducting research and developing resources is critical. And caregivers are one of the most important voices in dictating the quality of life for the whole family unit impacted by dementia. So when communities lead research, it's more relevant and more researchers are more accountable to meaningful outcomes, outcomes that actually matter to the people who are living with it today, not necessarily some promise of a better future, which is still motivating to people, but people need help now. So our research should have the capacity to do more immediate empowerment, support, and advocacy. So our council hopes that these findings will encourage researchers and funders, DPRIT is on the horizon, to study what matters to families who are impacted by dementia in South Texas today. This photo is a photo taken from a press conference that our council, these are two founding members and actually three founding members of our council. Sara was diagnosed with dementia and she and her son have been original members from day one of our council. They're hoping that we can help dictate what is prioritized in the funding landscape. We have a news article we'll share with y'all. I hope that you'll watch it so you can hear the priorities of our council and the extended voices of the South Texans that we've been connecting with. And we still are doing our platicas. You can follow us on our websites, researchforall.net. You'll also see there's two other councils, an Arab and Arab American Council doing similar work, and an African American Council in North Texas doing similar work. And we all partner together to make sure that our work is in tandem with each other. We are moving towards more social action, so keep an eye out for art exhibits and policy advocacy from our various groups. And you can follow our research lab at thecollectivecarelab.com. So thank you so much. I hope I was in time.
Perfect. Thank you so much, Dr. Masoud, for all of the information you were able to share quickly with us, and we'll get to in a second, about this important work and especially the dementia and Alzheimer's related priorities of South Central Texans. I mean, we couldn't agree more with you, as you said, about community members. When they lead research, we end up with more relevant and meaningful outcomes. So we're really glad to see that you're out there leading that charge. Now I will turn the conversation over to our next guest, Mr. Eddie Orum, who will share with us about his experiences as a lifelong educator, advocate, and community leader in the caregiving space. Mr. Orum currently serves on the Executive Council for AARP Texas and the Board of Directors for the Telspin Family Downtown YMCA, as well as the Board of Houston and Southeast Texas chapter of the Alzheimer's Association, where he also contributes as a community educator. Eddie, thank you so much for being here to share your work and your story with us today.
Let me begin by saying, first of all, what a great opportunity it is to actually be here today. I have been blessed to be a part of the caring of my loved ones, my aunt, who transitioned March 17th, on my mother's birthday, and I was caring for my mother, who transitioned on March the 29th, which was on my father's birthday. And so I'm going to ask you to share your slides because I'm having some problems here with mine moving forward. So as we prepare to do that, let me give you a little bit of history about how I became a part of the caregiving business. First of all, my mom and I were always close and were always going to be in a caregiving situation for her. My aunt was pretty different. My aunt was in the sense that when she began having cognitive issues, I actually went to her front door. And if we can go to the next slide, you'll see a picture of my aunt, to where I knocked on her daughter's door, had a conversation with my aunt, and asked, would you like to come and live with me for us to do this together? I didn't realize how odd and how strange that was until much later, because most people don't knock on someone's door and ask to be their caregiver. But as we move forward in the slides, I knew nothing. I had no information about Alzheimer's or dementia prior to this occurring. But I quickly learned that once you come after my family or my community, then we're going to have a plan to fight back. The first thing I had to do as a caregiver is to learn the difference between dementia and Alzheimer's. And many of you understand these differences, but I also had to make sure that I understood the different types of dementias, simply because there are so many cases where a loved one might have a mixture of dementias. In my loved one's case, it was Lewy bodies, which meant she would actually hallucinate or see things. In one case, pretty regularly, in her favorite place to sit, she would see young children on their bike playing on a rooftop. And I assured her that my eyesight was not as good as hers. So I would sit next to her and applaud her for having such good eyesight and ask her to describe the children to me. This was my way of making her feel comfortable, as opposed to letting her know that she's really not seeing this. This is not real. So I quickly learned that if I'm asked a question, then I'm going to give a true answer. If I'm given a certain reality, I'm going to go with that reality. And as we move to the next slide, we can begin to talk about communications and Alzheimer's and what it is. As we know, with this group, it is a brain disease. It causes problems with memories and thinking and behavior. The brain affects and causes us to react very differently. And there's one statement that I often hear with the Alzheimer's Association, and that is, if you've met one person with dementia, you've only met that one person, because all of our loved ones are different with the disease. In fact, they might be different tomorrow than they were today or yesterday. So as we move forward to talk about the disease, it is progressive, and there are different stages. My mom, who died of breast cancer, began to also experience some mild cognitive impairment toward the end of her life. So I began to deal with different people, different personalities. And as we move to the next slide, we can talk about what these styles really meant. When we talk about dementia-related behavior, I think of it simply as a way to communicate. It's an alarm telling you that a need is not being met. And it's up to us to figure out what is that need. And again, behavior is not always the same. And there may be good or bad days. And even the good behaviors are worth noticing. I had one case where on Wednesdays, a friend of mine would come over and paint my aunt's nails. They might walk around the complex. It might be the piano coming out. My aunt was an accomplished pianist. One day they were walking throughout the complex, and I didn't realize that my aunt was really thinking in terms of, we are going to visit someone. So as she walked in the house, I made some comment, and my humor is not always on time or even relevant, but I made some comment to her, and she said, well, I just met you. And I said, well, I'm your big brother's son. And her level of thinking at the time, she was probably middle school, which made him early college or late high school. Her first question was, well, does he know? And I said, yes, we've had a conversation. She was somewhat concerned that he had not shared with her that he had a son. I explained to her that he was going to have that conversation with her. She then, after thinking through the process, said to me that we have a very good family and you will be accepted. So even take those good moments to also understand what our relationship is. And let's move to the next slide. Most of the time when we talk about what triggers those behaviors, in my particular case, it was either a physical reaction, which means there's some pain or some discomfort, or maybe it's environmental, that people who are around are uncomfortable to be around. She's uncomfortable because she does not know the people or does not remember the people and realizes that she should remember the people, or it was big personal, to where internal feelings, and we apologize for the words misspell here, internal feelings experienced by the individual. So let's move to the next slide and get into these in more so of a standpoint. When we talk about behaviors, many times you might experience someone who's filled with anxiety or is agitated, and they might show signs of being restlessness. They might show some anger. They might be suspicious of who you are because they may not remember who you are. There were times when my loved one would refer to me as big bro. And that's when she was thinking in terms of me actually being my father. And that was always a plus for me. because I could accomplish so much more by being big serious bro than knucklehead nephew. So I would even embrace those times when we were being confused. I was being confused or getting lost or wondering simply because we don't know where we are, how to react, or what the reason something's happening. We had a conversation one morning about 3 o'clock in the morning. In my loved one's mind, I purchased a home in her hometown and we were across the railroad tracks, but we needed to go and check on her parents. So I would actually go with the flow. That's your reality. And tell her that it's 3 o'clock in the morning. Let's try to go when they are awake because we don't want to wake them up now and cause them to not be able to sleep. Another time, my loved one actually convinced me that she had a car parked outside. So I decided, okay, since the car's parked outside, let me go with you. Let's find the car so I can wash it for you. That simply was going to allow me the opportunity to where if she decided to go find her car, I would know which direction she was in. So I also took advantage of those times when I knew something was on their mind. How do I think ahead? We would often go to the CVS nearby. I introduced her to the people as well as my neighbors. So if she needed to leave for whatever reason in her mind, she had places to go. And hopefully there were triggers there. I was very fortunate because my loved one did everything that our U.S. Pointer research study says do, as for how to keep a resilient brain. And because of that, the intellect basically stayed. The memory did not stay. So we could actually have conversations. When we had the Houston water boil, it was very difficult to get her to understand that we can't use any water out of the faucet. But a week later, she would ask me, can we now use water out of the faucet? So I knew how her brain was beginning to work. One time, I actually began to ask questions about the brain when my loved one asked me if I were going to be on the second floor for a while. And at 92, her mobility was excellent, which had its good and bad effects. And I said, yes. She said, well, I'm going to go upstairs. I'm going to turn the light on in my bedroom. So when I'm ready for bed, I'll know which room is mine. And I began thinking, for a brain that is dying and diminishing, that's a lot of processing. So I then began to learn about cognitive reserve and began to learn about resiliency within the brain. So because of the behaviors that I saw coming my way, I could then look at these behaviors and figure out what the next step or what I could learn from these. As we look at the next slide, we'll see that gender difference in caregiving became very important to me. As a male caregiver, we don't tend to grow up thinking that we might have to put on our mom or our aunt's pants someday. We perceive that by accepting community services, sometimes that means I'm weak or I'm not man enough. We experience stress differently from women. We experience grieving process different. Most genders or some genders want to give you a hug. Other genders want to retreat. And when I lost both my aunt and my mom, I simply said, I need 2 days to hide under a rock. And then I'll take a hug. Then I'll take the food. So there are different ways. And we began through AARP, an organization called Men Who Care, to support male caregivers. And as we know, women tend to get the disease of dementia, particularly Alzheimer's, more than men. So there's a reason that I had to learn about male caregiving and then had to create a situation where other men could also learn. So a huge part of my caregiving strategies became looking at it from a male's view and working with other men who don't like to talk about what we're going through. Let's move to the next slide. As we said earlier, or the doc said, Hispanics are 1.5 times more likely to have the disease. African Americans, Black Americans are about twice as likely. We don't know all the reasons for this, but we do know that it's increasing our population. And what we do and how we learn and how we perform as caregivers becomes extremely important. The next slide, please. It does impact your family. It impacts, in fact, I learned from my experience that I did an excellent job of taking care of Mr. Orum, the professional, staying involved, volunteering. I did not do a good job thinking about the Eddie, the personal. When you spend about 10 years of caring for your 94 and 92 loved ones, your loved ones, you don't have that personal life. So you need to make sure that your personal life, your professional life is in place. We also understand that caring for someone living with Alzheimer's can take a very physical, emotional, and social and financial toll on yourself as well. I found that to be the kind of caregiver that I wanted to be, I sought therapy. So I began to talk with someone about how can I do this thing better. We also know the cost that's involved when you're taking care of people. And that's different with each family. But as a caregiver, you're looking at behaviors. You're looking at how do you respond to them. You're looking at what do I do next. You're looking at what can I also teach my team and help them to be aware of. Because this is not something that you do alone. And even if you are the lead caregiver, it becomes important to notice that there will come a time when power of attorney is no longer in effect. And as a nephew, my loved one had two children that I had to work with. So you want to make sure that you're protecting, taking care of, informing the entire family, even though you may not choose for the entire family to be part of the caregiving team. Next slide, please. We all know that there's signs of Alzheimer's, and I'm showing this slide simply so we begin diagnosing early, if not just simply making sure that we're seeing a physician. Because one of the things that we now know is that the medications that will work best in the early stages happen long before the behavior is shown. So once you begin seeing memory loss or challenges in planning or poor judgment occurring, we want to make sure we get a professional or a primary physician to begin looking at these ideas and looking at what's happening. And it may not be because of dementia. We also have the asymptomatic stage, which is there are no symptoms there, but my brain is developing the plaque. If we don't react fast, we're hurting our loved ones. We also have what we call the MCI stage, mild cognitive impairment. That could be due to dementia, which means the brain is being affected, or it could mean that you're just stressed or not sleeping. I was diagnosed with MCI, but not due to dementia. I was simply not sleeping. I was simply doing too many things and needed to make sure that I took care of myself, which is extremely important. So you want to know the signs, not only so you can look at what needs to happen, but you want to make sure that you're taking the action for your loved one. And why should we notice what's happening early and what can we do and what are the benefits? Let's look at the next slide. Early detection gives us a chance to pay attention. It helps us to plan. I live in a 4-level condominium. It's a great view of downtown Houston, but at 71, I don't see it as an aging friendly place. So I can begin making those changes. I can begin having conversations with my adult children. I can begin planning for the future, which we must all do, whether it's dementia or one of the other forms of dementia, Alzheimer's, Lewy bodies, vascular dementia. But early detection helps us medically. It also is important to note that there's now a blood test. With that blood test taken at our regular physician's office, we can find out if we have markers for the disease. Very inexpensive if we have insurance. Unfortunately, most insurance options are not available. I'm a member of a team through the Alzheimer's Association where we are going to Washington, D.C., have been to Washington, D.C., to talk about Medicare issues, taking care of those blood tests, making sure that we are looking at early detection and making sure that the insurance companies are there for early detection. Next slide, please. When we talk about treatments, we're going to go through this very quickly because this is not a session where we really talk about treatments, but we do know that things are being developed. It was mentioned earlier about trial testing. Talk with your doctor. Go online for alz.org trials. My concern before I began to be a part of research was that what if there was a cure, but the cure did not affect people who look like me? So I was able to have my brain tested. I had the MRI. I've had the CT scan. I've had the other kinds of cognitive tests of someone who has Alzheimer's in their family. So we want to make sure that we understand medications, and the medications won't solve the problem. They tend to affect symptoms of the problem. I was fortunate again, my loved one came to my home taking an aspirin. I took more medication than she did. So a lot of the medications that were out there might be for the anxiety. We learned that, as mentioned by the first speaker, the non-medical strategies tend to work the best until they don't. So us simply knowing what we knew about each other, consoling each other. We both were retired educators. So we saw this as a period to where we're trying this today, but if it doesn't work tomorrow, we change our strategy, as we do for students all the time anyway. Next slide, please. If you want to take care of your brain, we also learned, and this was something that U.S. Porter Research Study points out, my loved one did all these things. I saw a difference. She was always intellectual, skipped twice in school. At 85, she rode a bike. Blood pressure was always better than mine. Her sleeping situation was very good. She became smoke-free. I saw the difference in all of that. In order that to prepare ourselves, we just simply do those things we've been told to do. And as a caregiver, I learned that they're not just for those who are receiving the care. It's for us as well to take care of ourselves. Too many cases where the caregiver actually becomes sicker than the care receiver. Next slide. And we're close to the end here so we can have discussion. How can we help as far as Alzheimer's Department, Alzheimer's Association? We do have a 24/7 helpline. This helpline works. I've actually called them just to find out if they were real. So I could say to you, I've spoken with them. They do get phone calls with free education support, alz.org. You can see the different types of presentations, being an empowered caregiver. You can see ways of looking at how do you communicate with first responders? What do you say to them when they arrive and need certain information? I learned when I had to, on many occasions, called for help, the EMS. I knew which papers to have available to make sure that my loved ones were taken care of quickly, easily, with efficiency. And the next slide. We also have help in other organizations as well. We want to depend on you as an individual. What can you do? Share your personal stories. Join organizations. Become volunteers. Help your neighbors by providing education or support groups. The Alzheimer's Association and ARP will provide free support services to your group. As an organization, begin your own walk. Join our walk. Make sure you're in the community. Continue these types of conversations. If we move to the next slide. ARP has additional resources. Caregiving Resources Centers and Family Caregiver Support Line. Again, local caregiving resources directories. The National Suicide Prevention Lifeline is always important. So there are resources out there that are available to you. As a caregiver who had not had a conversation with anyone about dementia or Alzheimer's or any of the other types of dementias, I learned because of my loved one and because of my community. I implore you to make sure that as a caregiver, you learn as much as you can, because that we know can be very helpful to those who we love and those who are around us and those who will listen to us. Next slide. Our first founding president said, do things here and now, not if you're gone. If you have some money, share it. If you have some time, do it. Do something worthwhile. In support of my loved ones, it's now my focus to make sure I'm working with the community, that I'm working with others, because there's a lot more we can do and we need your help. I will go ahead and end my session at this time and say thank you. And if there are any questions, we're certainly open, because our vision is to make sure we have a world without Alzheimer's and all other dementias. Thank you.